Good afternoon, and welcome to another Webinar Wednesday. We are excited to have over 260 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. As always, we want to give one of our lucky attendees an opportunity to win one of the coveted Tech Nation Tour t-shirts for answering this week's trivia question. Our sponsor today, Sonotour, is headquartered in Connecticut. What is the name of the river that flows through Connecticut? Answer now using the question feature on your dashboard. While you're answering, I do want to invite everyone to the MD Expo Fall Conference, which will bring HTM professionals from across the nation to Orlando, Florida next week, October 5, 6, and 7, for 3 days of learning, networking, and the latest advances in technology, products, and services. Registration is still open online. You receive complimentary admission today by using the VIP passcode, compliments of the Webinar Wednesday series. You can find this VIP pass in the handout section of your webinar dashboard, or you can get more information online at mdexposhow.com. All right, let's see who today's winner is for the Tech Nation Tour t-shirt. Congratulations to Mark Robinson. He knew the correct answer was the Connecticut River. Webinar Wednesday would like to thank our sponsor today, Sonotour. Sonotour is the leading provider of unique ultrasound-based real-time location system solutions linking the physical world with the Internet of Things to provide real-time visibility and connected intelligence. As the first and only company that uses proprietary ultrasound technology as the primary technology for indoor positioning systems, Sonotour's platform automatically tracks the real-time location of movable equipment and people with 100% room and sub-room level accuracy in complex indoor environments, such as hospitals, clinics, and ambulatory surgical centers. With an open integration platform, Sonotour provides the flexibility to leverage best-in-class software application solutions covering many uses such as nurse call, patient flow, workflow and capacity management, hand hygiene and infection control, and asset and inventory management. For more information on today's sponsor, please visit sonotour.com. Our presenter today is Doug Burkott, Program Manager of Ascension Health Information Services, and Paul Schulz, Healthcare Consulting Manager of Eide Bailly. Doug, you may begin whenever you are ready.
Great, thanks Amy for the intro. Before I get started, I wanted to share a quick YouTube that we have about this hospital that was built and went live in May of this year. That kind of sets the stage for the selection of an RTLS system. This is the first RTLS system house-wide at one of our 9 hospitals here in Austin, Texas. So this is about a 3-minute video. Can you hear that? There we go.
Imagine a place that is the gateway to the future of care. Austin's new teaching hospital, Dell Seton Medical Center at the University of Texas, will be a game changer. In an unprecedented community partnership, Healthcare Family, along with the Dell Medical School at the University of Texas and Travis County Central Health, together are creating a new model of care. A model that trains new doctors in new ways to meet your needs. A model that puts you first, providing the right care at the right time and place. A model that turns ideas into treatments and treatments into a healthier community while bringing greater prosperity to Austin. Dell Seton Medical Center at the University of Texas will anchor a new downtown health district. And in it, brilliant teams of caregivers, researchers, physicians, and innovators will deliver a new standard of person-centered care. Designed as the community's only Level 1 trauma center for adults, The new teaching hospital is created to be there when you need it most, while providing a healthy, healing environment that delivers on our promise to treat you with the dignity and respect that every human deserves. With more space for critical care patients and advanced surgical procedures, the new hospital is built to incorporate complex medical equipment and breakthrough innovative technologies. A hospital that stands ready to serve the community today while prepared to respond to the challenges of tomorrow. Together, we will transform the health of Central Texas.
So my apologies for the elaborate soundtrack. I always kind of giggle a little bit when I hear that because it's just so elaborate. But it is actually a very beautiful building, incorporating all the latest technologies from infrastructure to applications. So starting out, surveying our stakeholders, these are some of the things we wanted to gain by implementing a real-time location service product in our new hospital. So we wanted to make the work life easier for nurses. We wanted to make patients feel like they're in a world-class facility. We wanted to make it easier to track and locate equipment. And we want to install an RTLS system that can scale for future needs, not just within this hospital, but any technologies that we deem helpful and useful and cost-effective. We want to roll those things out to our other 8 facilities here in Austin and surrounding areas. So we wanted to have a system that could scale to that sub-room level, so 2 by 2 or 1 by 1 square foot area, to an entire room, to a hallway, to a hospital, to all 9 of our hospitals. Some of our related projects were a Cerner shop, as they call it. Related projects that had to integrate with this RTLS hardware was Cerner CareWare tracking. So that's the software side of the RTLS system. We put the location tags onto equipment, so IV poles and wheelchairs, we'll get to that in a second, and then to staff members. So we wanted to track where those people or where those things were in the hospital. The other solution that incorporates RTLS is Cerner CareWare MyStation. And what that is, it's a patient infotainment system. So it's a TV, they can access just, TV, movies, there's relaxation content, there's education that can be ordered for them. And there's also a component where if a staff member walks in the room and the staff member is wearing an ID tag, we've incorporated their picture and their title to appear on the screen of the TV when they walk in. So whereas a patient's sitting in the bed, staff member walks in, well, you can't see from 15 feet away, their name on their badge, on their physical staff badge, but you can certainly see it on the TV. So we want, again, this is getting back to, we want to make sure patients feel like they're in a world-class facility. And by having all the people announce themselves on the TV, it makes them feel like they're in this world-class facility. Also, it's important, I think, for patients to know, well, who's been in my room maybe when I was asleep? And again, with RTLS system and the Cerner system, if someone comes in while the patient was asleep, they can actually go back into the application on the TV and see who was in their room and at what time. The other side of it is, and we hear this a lot from maybe not patients, but maybe the patient's family members saying, my mother's in the hospital and she said no one came into her room today. And we can just bring up a report on the screen or even in the electronic medical record saying, well, actually, all the staff members are wearing an RTLS tag, and there was 12 different people in the room, and the nurse was there 8 different times. And so that's another way to kind of, again, make sure that we're accountable and we can prove that staff members were in there. Third project associated with RTLS is a local company in Austin called HCS, and they make a product called OR Control, and that's a surgical tracking system. So tracking where the patients are in each of the different surgical bays. So we've attached the location tags to, it's actually not to the patient, but to a clipboard that's kept with the patient. So we track them throughout their stay in the surgical suites. So some assumptions, as any time you start a project, you always want to make assumptions that people can agree to, and that helps the selection process of the product. So we wanted to have a system that can be used in all patient rooms, all hallways, any place where medical equipment may be stored, or that staff may be. And communication amongst the RTLS sensors will be done through the building wireless Wi-Fi system, and the wireless infrastructure is sufficient to accommodate this traffic. So part of the technology is the badges relay location information to a location transmitter that's in the ceiling. The location transmitter then uses the wireless hospital infrastructure to communicate that information to a location transmitter, which is hardwired into the building. So there's actually a bit of wireless infrastructure that has to be in place. It's very minimal. We're not talking a lot of data that goes across this. But again, that has to be an assumption that's validated before we start the project. And also something to keep in mind if you are working with a RTLS system, and for the most part, all the systems as far as that technology goes, as far as using your wireless system, are pretty consistent amongst the various different vendors. The location information, how that's gathered, is different amongst the different RTLS vendors, but the fact of having to have a robust wireless network is a constant across all the different vendors. So some of our business requirements, as I mentioned before, we wanted to kind of start small and just track mobile equipment that is kind of either difficult to find or is problematic to locate. So we just said IV poles and wheelchairs. We kept it real simple. We're not, in fact, actually since go live, there's been a lot of use cases to expand beyond IV pumps and wheelchairs. And that's actually quite simple to do. It's you buy more location tags, you associate them to the equipment, and on you go. And there's been at least a half a dozen other pieces of equipment that have been identified to benefit from RTLS. Another requirement was we wanted to track arrival times of emergency clinicians to trauma cases. So there's actually some reporting that's needed, might be at the state level, it could be federal level, or a certification for the building, that they need to track when a caregiver arrives to the, an ED provider arrives to the ED in the case of a trauma. And so you can actually measure that, and you can be determined exactly when that person was in that room with the patient through an RTLS system. Present the staff photo, name, and credentials on the Cerner MyStation TV. Also tracking caregiver time with a patient. So back to, again, either a patient or a family member that would like to know when they were there and how much time a caregiver spent with the patient. And then location information for patients while in surgery. That's the, and actually, you'll see this in a bit, but that's actually like for like. We actually had the older version of Sonator's equipment in our old hospital, and we needed to make sure that the new version of Sonator, which we implemented, was with the OR control system at the new hospital. So there was a bit of making sure we nailed down these business requirements before we selected any vendor. So part of this evaluation process is like I said, we had Sonator as in a small footprint of our hospital. Now they were not the heir apparent by any means. It worked fine, but I was given the challenge of going out to the market and determining, okay, so we've had RTLS in a small part of the hospital for the last few years. Go out to the market, see what's there, what's the latest technology, survey the different technology partners, survey existing clients that have implemented this, and then come up with an evaluation. So basically, this presentation is to some degree an extrapolation of a document that I came up with that had weighted questions and scores, where I went out and basically reviewed 3 different hardware vendors for RTLS and how it came about the selection of Sonator, as I've mentioned. So one of the thing that really matters in my mind was, how does the technology work? All the RTLS systems, they all track down to a certain degree of location granularity. So when you're evaluating technology partners, really understand what that technology is and what's the basis for it. Sonator is a sound-based RTLS system. And the thing that I thought was attractive about this being an indoor location tracking service, is that sound is enveloped in a space. So you can keep, versus other technologies where if there's a window, well, that signal from the location transmitter can go beyond a window and go outside. So to me, it made a lot of sense that sound is contained in a room, or can be contained even within a room by setting up virtual walls, as they're called, and to get into that smaller granular space. There was no, in my evaluation of other customers that had selected this product, there was no dead spots reported. Whereas if there's some technologies that use light, well, light can be shielded, light can escape a window. It's a lot harder to kind of corral light than it does with sound. The one thing that I wanted to make note of, and we were asked to do some evaluation on this, is building materials. So building materials can be interrupted by radio frequency or even light. The one caveat that they made sure we evaluated was that there are some light switches that are activated by sound waves. And so we had to basically ask our building engineers to understand what technology was being used in our lighting system, and that sometimes they can use sound waves, and other times they can use a different technology or different frequency of sound waves. Because obviously, if the light switch is using sound waves, that could interrupt the quality of the sound that's going to our location transmitters. So that was just one thing that we were asked to make sure that was not in place in this building before we went forward with the project. Another differentiator in these products was the number of location transmitters that are needed to achieve location granularity. So for example, I talked about virtual walls, and a good example of this, and I wish I had a picture of it, and as I gave tours through our new hospital before it went live, is on the different post-op bays, because post-operative, it's all, one big room with different patients, within 10 feet of each other, sometimes separated by curtains, sometimes not. In order for us to achieve this location granularity within those bays, because again, it's a big open space, we really only needed to have a location transmitter between each of those bays. Now, to achieve the same location granularity with other technologies, we actually would have to do 3 different location transmitters per bay. And that's important because these location transmitters, and again, this is across the industry, all the different RTLS systems, for the most part, operate off of batteries. So if you can imagine, we have 750 location transmitters requiring 4 D-cell batteries throughout our entire facility of 220 beds. So again, that's across all the vendors. They all require batteries in the location transmitters. Now imagine if, I think I did the math, and we would have had to have something around 1,800 of these location transmitters, again, with 4 D-cell batteries that last around 2 years each. So the operational cost of having, 3 times the amount of location transmitters to achieve the same, or in this case, for us, a smaller granularity, that made sense. That was kind of that was a big selling point of of this product. The one thing that was not a big differentiator for us, but there are lots of different tags that are used in the industry. Sonator obviously has their sound-based tags and different form factors. There are some other companies out there that have a greater variety of tags, and that gets back to, what are you trying to accomplish? And for what we were trying to accomplish, we didn't need a big variety of tags. But I can say that Sonator does quite a bit of R&D, and they are actively evaluating what their customers want and matching that with where they invest their money. So some customer testimonials. So I went out and I surveyed 3 different customers per product that I evaluated. And the one thing that a story that was shared with me is there's one hospital and they had the previous Sonator product called Tag ID. And actually it wasn't working for them. They went back out to the market and said, this is not the location granularity that we'd like. We're going to go back out to the market. We're going to survey the market. And at that same time, Sonator had released their new product called Sonator Sense. And at the end of their evaluation process, they actually reselected Sonator on their latest platform because it achieved that location granularity that they needed. The other thing that a customer shared with me that really kind of hit home is, understanding the needs of a customer, after the sale is done and after the implementation is getting ready to come to a conclusion. So this one customer shared with me that they had 500 tags delivered to them, and all of them were less than 50% battery life. There was some mix-up with how they were procured, and when Sonator heard about this, they actually drop shipped another 500 to them. They brought in executives from Sonator to understand what happened, and they were very quick to solve the problem and make the customer's problem their problem. So that was to me, knowing that this company is there, after the sale and after the go live, is a big thing, because I deal with lots of different solution partners, and knowing this just made me better informed about how to select the product. So the technology platform, I talked a bit about this already. Again, documenting your business needs and understanding what the needs of the project sponsor and the stakeholders, and evaluate the technology, get into the weeds. Have your technical subject matter experts review the technology. It doesn't meet your needs, can it scale for future growth? What are those operating processes and costs? As I mentioned, with regard to replacing not just the tags that they become destroyed or the batteries within the tags, but the batteries within the location transmitters or in the facility. And then also, are there any physical or environmental barriers to consider? What type of building materials do you have, and do those interfere at all with your RTLS technology? And gather testimonials from these customers. So ask specific questions about the contracting and sales process. Talk about how the implementation went. Understand the operational handoff that was done, and to what degree did they make your problems their problems. So I'm going to end there, and I'll hand it back over to Jamie. I'll be available for questions.
Great, Doug. Thank you. And quickly, attendees, if you'll bear with us, I'm going to change control of the presentation so I can share with you a video message from our other presenter today. I do want to let you know, a few of you may experience a black screen. That's perfectly okay. The audio should come through perfectly for you. This video is going to run about 25 minutes, so if there is nothing visual, please do stay tuned, listen to the audio. We'll come back on and launch the survey at the end and wrap up with a live Q&A. Please do feel welcome to submit those questions anytime. All right, guys, thank you, Paul. I appreciate the input and the information that you could share. First, attendees, I do apologize. There was a bit of an echo at the beginning of this presentation. We were having to work through some kinks, but with the live webinar and presentations, these are things that happen. So I do appreciate you staying tuned and keeping us informed of what you're hearing through the chat and the question feature. But Doug, do I still have you on the line? Can you hear me?
Yep.
Great.
Yep, this is Doug.
Good. Well, as as you were presenting, as well as Paul presenting his portion, I do have quite a few questions that have come in from attendees. And looking at our time, knowing we're about 8 minutes shy of our 60-minute allotment, let's see how many we can get through. But I want to assure the attendees, if we do not get to your questions, we'll send them all to Sonator. They will follow up with you offline. But I'm going to ask the question. You can decide who is the best representative to answer. But first question is, who was represented in your decision-making group, and what was the composition of that group?
Yeah, so here it was our senior leadership team, composed of our CIO, CMIO, and the president of that particular hospital. And mainly because there was so many systems going into that new hospital. I mean, there's hundreds of systems. Most of it were previous to the other hospital. They made the decision on my recommendation. But we did have those deciders in place that they decide, you know, all the other major things.
Are all clinical staff in your hospital able to locate equipment, or is it the ability to locate equipment restricted to managers, biomedical engineering?
Yeah, no, not at all. It's open to anybody that has a login to the Cerner system that can locate those IV poles and wheelchairs. And beyond that, I didn't get much into the other equipments, but apparently a piece of equipment called a bladder scanner, you mentioned that to a nurse and they all roll their eyes like, oh yeah, it's hard to find the bladder scanner. So that's one of our next things that we'll be locating. And anything that you can affix a tag to can be tracked in the system. And it's mostly those things that that commonly are misplaced.
What platforms did you evaluate, and how did each address issues like floor hopping, dead spot, and sound wave interference?
I evaluated Versus, Centract, and Sonator, and to some degree, Stanley AeroScout. And that list is narrowed down based on who Cerner certifies. So if you have a different EMR, they might certify other systems. But I narrowed it down just based on, you know, what Cerner certified. It works with their platform. A lot of it did have to do with the fewer location transmitters that are needed to achieve the same location granularity. And I really bought into the whole, you know, how a sound envelops a space versus having to be, you know, to some degree line of sight for technologies that use light. And interference with building materials, and interfering with RFID. So some of the responses to the floor hopping came from the fact that, well, those technologies can also, they have smarts, we'll say, or rules built into the system that in order for that tag to go to the next floor, it has to go through a choke point, which is typically an elevator or a stair or something like that. So that their counter was, well, it may floor hop, but also we've got smarts built on our system to mitigate that floor hopping that happens. But I did still hear reports from biomedical engineers at the facilities that said that they still did experience some floor hopping with the RFID technology.
Great. And were you able to see significant differences in the RTLS platform in terms of efficiencies, such as number of transmitters needed, battery life, etc.? Or what other elements were you looking at?
Yeah, good question. Battery life, they're about the same, honestly, and it's as active as the user is hitting different location transmitters. They're all around a year and a half, both on the tag that's worn by the staff member or the tag that's on the piece of equipment, as well as the batteries that are in the ceiling. You know, one of the differentiators, and it adds up. These are D-size batteries. One of the differentiators was one company uses lithium battery cells. The other one uses just regular alkaline. So there's obviously a big price difference in the batteries, you know, to the tune of $5 or $20 per battery. And so it sort of made sense to kind of go with alkaline, considering that those are, you know, easy to find, they're a lot cheaper, and the battery life was the same on those location transmitters, whether they were lithium or if they were alkaline.
Perfect. Well, we still have quite a few questions in queue, so we've reached the 60-minute mark. I'm going to go ahead and send the rest of these questions over to the Sonator team for them to follow up with each of the attendees offline. I do want to thank you again, Doug and Paul, for the presentation today. And of course, a big thank you to Sonator for being our sponsor. You can learn more about this company again by visiting their website, sonator.com. SONITOR.com. You should be able to see their logo there on your screen. One lucky attendee will win an Amazon gift card for completing the post-webinar survey. The survey is going to appear on your screen shortly. You must complete the survey to obtain the certificate of attendance. If you don't see the survey, please email us at webinar@mdpublishing.com. We're back next week with another great webinar. This one will be sponsored by UMRI, and we will have webinars every week for the next 3 months. You can find our upcoming calendar by visiting technation.com/webinars. Enjoy the rest of your Wednesday, and I'll see you guys next week.
Jamie, thank you. Good afternoon, everybody. I want to share the RTLS journey that we've taken with a hospital north of us here. They've done a great job, and the technology and the data and what they've done with it has provided just fantastic patient results. Jill Wilson is one of the primary leaders at the Altru system, and I really enjoyed this quote with her. It's without investing into different tools and supplying more accurate, operational information, we can't reach a transformational stage for new phases of care. And that's a statement in retrospect. After their 2-year journey, I think leading into this initiative, there's always questions as to how this will really provide value into the organization, and the value that's been presented now has been fairly significant, and I'm looking forward to sharing both the journey and the results of our efforts with you today. There are some building blocks as we look at this culture of innovation. The RTLS technology and the data really does provide transformational vehicles, but it's the innovation that takes place when the team gets this information that is so fun to watch. And I want to share with you just a few of these building blocks. One of the things that we really want to do is get better, more useful data and visualizations of the data. Sonator is a very accurate system. We've had very little downtime with it, and the accuracy is phenomenal. And with that becomes just a plethora of data that just was not available before. And we use a thing called business intelligence, which we'll get into here in a few slides, to make that visualization clear for the folks providing care at the front line. All this is coming in real time, and one of the challenges that we try and meet in healthcare is making sure that we're informing at the pace of care. Doctors and nurses are working real hard to get things taken care of for the patient, make sure that things are flowing through the facility or the organization as it should, and things are clicking really fast. And when we provide real-time information so they can understand how things are flowing, or maybe better yet, understand where things aren't working very well in real time, that is extremely helpful and important. And then moving these, once we flow the data and the team is starting to work, ideas pop up, and we're going to talk just a little bit about how we can get these ideas to take hold in the organization and sustain some of the value that people are looking for. Here's an example of business intelligence that we've done. You can see that there's a number of different things going on here on the screen, and reason why we do this type of work is because we can do correlative values. We're understanding where people are, we're understanding where resources are, we're understanding where they are in the organization, what room, and when we apply that to patient care, we start to understand value versus non-value added time. We can start looking at cycle time, the time it takes for a patient to enter a care area and go all the way through the clinic or through radiology or through lab. We can understand utilization rates of pieces of equipment or room. And once we start bringing these components together and correlating them, it creates a very robust picture of what's really going on in the organization. And of course, excuse me, in the arena, excuse me, of continuous improvement, one of the things that we always want to do is now we've taken the business intelligence report and we've simplified it. And we found that with all this data, there really are just fewer things that we want to look at. And in Altru's case, we look at value versus non-value added time for the providers. We look at the cycle time and the different milestones to reach that cycle time. And if this were live, you could see these bubbles move. And at the end of the day, or even at the middle of the day, the doctors, the nurses, the administrative leaders are looking at this information to understand how they can adjust for that day of care or for the flow of patients that are coming through. And that adjustment isn't random. It's based on real good, accurate information. So then the adjustments don't cause more stress. It really does relieve a burden, and we can do a better job of building that value for the care. Getting operational data that we've never had is really important. And from the standpoint of, if you think about a hospital or a clinic, roughly 55–60% of the budget is in human resources. And we have another 25 to 30% of the budget is in supplies and equipment. The two together, you end up with about 75% to 80% of your budget. If you don't understand how those components are moving in your organization, that makes it very difficult to do process improvement. In other industries, when they do process improvement, there are a fairly clear understanding of what's happening on the floor or in the area or wherever the place is the work is being taken care of and being done. In the hospital and the clinic environment, that's very difficult because the patient typically is moving from space to space. And so the person providing that care has visibility for the patient for that period of time and not across the continuum. So when we look at understanding that continuum of care and understanding on how these resources are impacting that continuum of care, we can make very smart, very intelligent adjustments, and that's because it's with data we've never had before in healthcare. So this is a very important piece as we look at the transformation of healthcare and moving into a stage of innovation. You'll notice here on the screen, and other people may be covering this, we have the monitor up on the ceiling, the sensors at the tags that are on pieces of equipment or on staff or on patients, ping back and forth, and that works really well. The piece about Sonitor that we've enjoyed is that the signal doesn't hop. It doesn't move from floor to floor. When we talk about accuracy, it's the data that people have a tendency to second guess or want to point fingers with. And when we have the accuracy that we have, when we know that the person is there or the piece of equipment is in this room and the signal isn't hopping from one floor to the next or across walls, that builds confidence with the team, and then we're able to find ways to build solutions based on the information that we're gathering. We have looked at other systems. They're good. All technology has a very useful space in the right application. But when we're looking at ambulatory care or flow in the OR, or we're looking at patient flow across the different hospital units where there's a lot of mobility, the Sonitor system seems to work out really good. I want to present an example here of how data moves. There's a number of different vendors that provide software that link up to the Sonitor hardware technology, and that software gathers these different data points and creates workflow. I think not all software is the same, but generally speaking, it has similar characteristics to it. We were pulling the data specifically out of the software and creating our own reports, and from there we started developing numbers and understandings that just weren't in the hospital environment before. When we looked at cycle times through different phases of care or different aspects of care, this provided the team a really good understanding of, well, where should this be, and how can we do better, and more yet, what are the expectations? And I think building expectations across the continuum of care or in the care environment is difficult because we don't have expertise in the different step of care, whether it's in lab or radiology or wherever it is. So we rely on folks to provide us with that information. And then even when you're working in those areas, it's tough to understand, exactly when did the patient arrive and when did they leave, and what are the 15 or 20 or 100 things that happened in between, and how do we dissect that in order to make this work better? So as you can see here, we looked at cycle times for different providers. We looked at cycle times as they go through the segments of care like radiology. We're able to understand wait time that happens in the workflow, and because we know it, we can do something about it, which is pretty fantastic. People ask, like, what really is something that you've seen with this system that you don't see other places. The outlier piece is something that is difficult to identify if you don't have this technology or you're not pulling this data. And what the outliers do is it helps us understand that here's an instance where things didn't go well. And this is pulled in real time, and you can see it in real time. And what this does, you can see the outliers for wait time prior to the first encounter of the nurse. And this allows us to do a root cause or a 5-why pretty quick, and we can make real-time adjustments in the flow of care based on why these outliers happened. And it's interesting. You'd think that over time the outliers would disappear or they'd be dramatically reduced, but they still show up because the amount of variation that's in healthcare that people try to manage is almost impossible. I mean, there's weather changes, there's events going on in the community, there's there's a flu bug that hits. I mean, all these things will impact your flow, and as it impacts the flow, we start seeing the outliers, and we can understand that, oh, this computer over here isn't working very well, or this person over here is having kind of a tough time because things are backlogged, whatever it is. And then administration has a very clear path as to how they can move things around or how they can make adjustments to help that flow work better. Now, the first thing that does is that starts to alleviate some of the stress or the stress points in the process that have been identified. The care providers appreciate that. Things are flowing better. The patients appreciate that. And over time, the operation starts to move towards that optimization, and that's the point that we want to go to. The one thing that we learned is that the conversations that came because of this changed dramatically, and the staff was having conversations earlier, like, gosh, it'd be better if, next time, and I hope, and, I don't know why, but, today was really difficult too. Our cycle times in this practice or that practice or in radiology were a little high today because of these root cause. Tomorrow we're going to adjust. And the conversations were focused on great information and data that they could use. And that started to remove 2-3 minutes of waste or stress points in the workflow as patients went through the day. When we talk about understanding, okay, now what happened? We do the root cause, and we understand the whys, and we want to fire something up. It's important that these ideas get mobilized in the organization in a fashion that it doesn't crush something else, and we want the changes to be sustained, and we want them to stick. So this is an example of a visualization board or a visibility board, and in the middle there you can see some of the BI sheets, and the RTLS information is fairly consistent as the team huddles on and in this case they huddled on a weekly basis, and when things were a little bit more difficult, they huddled more often. But when the team huddled around this board, here's the information, here's what we're trying to accomplish. These are the project sheets that are going on, to try and fix things. So communication and data played a very key role as the organization innovated and moved forward. And I think for those of you out there that are interested in this system, be cognizant of that this data is going to be new. It's new to leaders, it's new to staff people, it's new to providers, it's new to patients. So in that mix, great communication and a structure for communication should take place, and then that way you can start absorbing the data and making some of the operational changes, moving towards optimization of which is what you're looking for. This is just a real quick 1 through 5 kind of thing. We just made some rules that leaders would go first when we did this, meaning that leaders would stand up, they would start filling out the project sheets, they would round, they would go through the 5 whys with teams, and they would engage into the project management process. And that lets leaders truly understand what it's like to put these tools in place and have them work at the front line. And it worked very well for us. Because this data is coming forward, and it's new data and the new operational data which we didn't have, we're able to create now with projects a real strong delta of, this is where we're currently at, this is where we should be, because the system is running. As we apply operational changes, we can see if we're moving in the right direction or not. So this takes the strategy of hope out of the equation, and we're replacing it with our current cycle time or flow rate is X. We want it to be Y. These are our ideas to change it, and we can watch that improvement happen. And it's either really invigorating for the team because they're like, wow, cool, we're hitting this, or it's very informational for the team. Hey, great, here's something we tried but it didn't work, but this is what we learned, and this is what we can do next. Our improvement tools were really simple. We didn't get deep into the Lean or Six Sigma or IHI tool set. We used simple flow diagrams, 5 why. We did some spaghetti work, and really that's kind of where it ended. And we used the data to set up the story. We used the tools to tell the story, and we used the data again to bring a summation to the story. worked very hard to align things. This data and understanding of flow will consume some conversation for the team. And so when there's a number of initiatives going on, it gets to be a little much for the care team. So we wanted to make sure that we were very focused on what we're trying to accomplish, and that we were aligned with the organizational strategic initiatives as well. And some of you folks out there might be saying, well, yeah, sure, that makes sense. I mean, why wouldn't you do that? But it's interesting. Sometimes there's a lot of initiatives that can get piled up at the operational level and can be confusing for staff. And when you start supplying this new information, again, we wanted to keep confusion at a minimum. And then the accountability piece, when it's leadership led, the momentum that created for change and innovation was pretty impressive. Okay, so let's get down to some of the brass tacks. So what happened here? This is a clinic of about 7 doctors in orthopedic. They're surgeons, so they want the clinic to go well. They want it to work well. They have a fairly substantial market, that they're servicing and taking care of. And access was an issue for this clinic. We were always concerned about burnout for the doctors. We didn't want we don't want to just keep piling up work and not have the ability for them to balance their lives. And so when we looked at reducing cycle time, we were very cognizant of the fact that extra time will be used for maybe different things. Some practices will, fire up and want to bring in more patients. Some practices will use this time, to balance out their workload in different areas. And we left that open for them to figure out, where this extra time goes. And when you think about this clinic was seeing, hundreds of patients in a week. So if we're reducing our cycle time in this graphic by 15 minutes, and it's gone down by another 8 from there, you take 15 times all the patients rolling in the week, and that is a lot of minutes that's put back into the care environment. Those extra minutes, like I said, were used to balance things out, either from adding patients or creating a better work life for folks. And so here we are. This is about after a year and 4 months, somewhere there in there after implementing the system. There's a number of different things to be proud and excited of. If looking at this from a not a third party, but from more of an outside point of view, because I'm not embedded in the clinic every day, I would say that the confidence that this team has to provide care in the time period that has been set up, the confidence they have to know that the next phase of care is being done, and it's being done well, is something that just continuously feeds upon itself. The innovation of this group has been extraordinary. They have tried new things with different roles within the area, because the data that's brought in by RTLS constantly supports or motivates the team to move into these new areas. And I think when we look at organizations that don't have this system, it's difficult to understand, okay, where did our improvement really take hold? Where is the ROI, on this project that we're working on? And with this system, as you can see from these numbers, we were able to produce, and now the organization is moving forward with RTLS in a number of different clinics. So what we can do, listening today, there are things that leaders should do. If we go back to what Ms. Wilson said earlier, that without an investment and without bringing new information to help with the transformation of care, it's difficult to make those changes. And looking back, the willingness to step out, take a look at what it is that we need to invest in, that's a smart investment that's going to add to the value of the operation, add to the experience that the patient has when they enter the clinic or the surgical area or the hospital, and making sure we're always building on that triple aim it takes an investment. And this has been one of the smarter investments, I think, because it's very tangible. You can see what's happening, and you can see and you can measure your changes. And this process of starting to know and stop guessing is so important. The finger pointing, the blaming, it's not the Ford, it's the Chevy that breaks down all the time, or it's not the Chevy, it's whatever it is. It's not me, it's them. That dissipated, and replacing those assumptions with absolute knowledge about what's going on has released some of the intellectual capacity within the staff, because healthcare is made up of very smart people who are very passionate about providing care. So once we give them this new data, starting to see the unleashing of that, and that's where these cool ideas came from. The growing your capacity in the organization is what leaders can do. Sometimes we look at organization and say, it's not like there's a shortage or of people who provide care as much as there is a shortage of ways to get rid of the waste of care in care. And we found significant capacity in that orthopedic clinic, and that capacity was filled with new patients, and it was filled with the balancing of surgeons' clinical time. It was that led to many great things. So there is capacity in organization, but I think it starts with understanding truly how your operations run, and that comes from new tools like the Sonator technology that brings the RTLS data forward and visualizes it for teams that then can take it and make smarter decisions. So with that, I want to thank you very much, for your time, and I look forward to your questions if you have them later on. Thank you.